but we're wanting to bring you a community immunity moment, and we're going to start, since it's Black History Month, with some information about Dr. Kizzmekia Corbett, who is a 34-year-old African-American immunologist and professor at Harvard, and she was named one of Time Magazine's 2021 Heroes of the Year for her instrumental work in designing the Moderna vaccine. She's also become a public advocate for the shot, saying that she does not want to be another hidden figure and knows the importance of her presence on the team to the African American community.
The vaccine remains the best way to keep us all safe and alive. Without it, it is estimated that the number of COVID deaths would have reached 2 million rather than the 900,000 plus Americans who have died to date. The vaccine prevents people from getting sick enough to require hospitalization, and without it, hospitals would have been overwhelmed by an additional 10.3 million people needing care for COVID infections. Now, this number does not include all the people that likely would not have received care for heart attacks, strokes, and the other urgent illnesses that require a hospital because the hospitals will have been overwhelmed with the COVID admissions. Once again, think about this. More than twice as many people would have died of COVID without the vaccines, and probably much more than that would have died of other causes. Not getting the vaccine is like driving a car without a seatbelt and very, very bad brakes, in a place where the other drivers aren't wearing seatbelts either, and their brakes are failing as well. You may get home in one piece, but you've increased the chances that you may be in a fatal accident for you or someone else.
A recent study showed that people who are fully immunized, 2 shots and a booster, are less likely to become infected with COVID, much less likely than those who have not been immunized, and even those who have received 1 or 2 shots but no booster. Everyone is more susceptible to the Omicron variant, but the vaccines still offer more protection than being unvaccinated and protect you from severe illness requiring hospitalization. This is from an article in the Journal of the American Medical Association, January 21st, which is quite recent. Even if you've had COVID, the recommendation is that if you have not gotten the shot at all, please get it as soon as possible. If you have had the original 2 shots and it's been 5 months or more since your last shot, then you need the booster shot. If you only had Johnson & Johnson, a booster is also recommended as soon as possible. Within 2 months after the Johnson & Johnson, you can get your booster. You can get either the Pfizer or Moderna booster, no matter what your initial shot was, unless you're a teenager, then you need to get the Pfizer. Think of the shot as the seatbelt. Wear a mask indoors, especially in close quarters. Think of the mask as the brake. The N95 and the KN95 masks are very effective in protecting the wearer from getting the infection and also protect whoever they come in contact with.
So if you want to come to our church to get the shot, we will have a clinic here on February 26th. That's a Saturday. Please go to the Get the Shot website and register for this clinic, as they need to know how many vaccines to bring. You can also get a flu shot at the same time if you wish. There are shots available all over our city in drugstores and health centers, so there's no reason not to get a shot if you want to have one. If you aren't sure about getting a vaccine and have questions, please contact us so we can help you work through the questions together.
Remember, in other countries where there is 90+% vaccine rates, they are doing much better at stopping corona in its tracks in those countries. So we know that the vaccine works, and it not only protects you, but it protects everybody in your community. So stay safe out there and get your shot. Thanks.